Hi, so I'm going to do my video for my week 4 video for my cranial nerves, my neurological functions examination. So what we're going to do is we're going to be looking at the 12 cranial nerves and what they're doing and seeing if they're intact and making sure that they're all working properly. We're going to check like sensations of your body also, and we're going to make sure that it's all strengths and your motor strengths are intact and all the fun, nice fun stuff. Okay, so what I'm going to do is I'm going to walk in the room and say, hi, my name is Taylor. I'm going to be your nurse today, do my hand hygiene, do my normal stuff, assess all my stuff that I need, my other stuff, a little, whatever. All my equipment, get it all ready. Ask about allergies, ask about my pain scale 1 to 10, where it's at, what it feels like, so forth like that. So then I also check for their alert and orientation and make sure they know person, place, time, where they're at, and they do, and it's alert and oriented ×4. I'm making sure that I'm paying attention to their mood. I'm paying attention to their dress, their clear speech. So my patient seems to be nice, in a good mood. They have clear speech, no signs of any slurring or anything. Their dress is nice and appropriate for the situation. So my patient seems to be nice and healthy in that part. So whenever you look at them, I'm noticing that their posture is nice and erect. They're calm. So they seem like a nice, like, healthy human. So first, what we're going to do is that we are going to assess the cranial nerves. So what we're going to do is we're going to test the first cranial nerve, which is the olfactory nerve, which goes along with smell. So I'll have like a candle right here, and what I'm going to do is have them smell it and see if they can smell the scent of the candle, and they can, so then their olfactory cranial nerve is intact. Next we're going to do is the cranial nerve 2, and it's the optic nerve. Normally for the optic nerve you do the Snellen chart, but I don't have a Snellen eye chart, but the optic nerve is also intact for me if I'm looking at the Snellen chart for me or my patient. Okay, so next is the cranial nerve number 3, and it's the oculomotor nerve. So we're going to do this with Perla. So I have a pen light right here, and then I'll put it through my pupils and make sure my pupils are equal, round, reactive to light, and accommodate, and they are. So that means my oculomotor cranial nerve is intact. Okay, next is what? Next is my trochlear nerve, so my CN4. So next what we're going to do for the trochlear nerve for my cranial nerve 4 is we're going to do eye movement. We're going to use the wagon wheel test with this also. So we're going to do it like we're going to look over here, like you're going to put things to follow in the light. Follow up, look down. So we're looking forward, so we're making sure not one eye is going and looking and following me, and the other one's kind of slumped and moving around like that. So we notice that our cranial nerve 4 is intact, so that's good. Our trochlear nerve is intact. So next what we're going to do is that we have the trigeminal nerve, which we're going to test for it with a clenched jaw. We're going to inspect the clenched jaw with the masseter and the temporal. So I clench my jaw and I feel around, and it's all clenched, my muscles, everything temporal. So our trigeminal cranial nerve is intact for that. Next we move to 6, our abducens, which is eye movement, which is the same as 4, right? 4? Yeah, so it's the same as 4. So we use eye movement again, and it's intact as well. Next is 7, which is the facial nerve. So this is cranial nerve number 7, and what we're going to do is we're going to inspect a smile, a frown, and then we're going to raise your eyebrows. And since I can do that, since my cranial nerve 7 is intact. So then cranial nerve number 8 is a vestibulocochlear nerve. So it's our hearing test. So then we do the Weber and Rhines test, check for lateralizations, check for conduction of airflow. It's a 2-to-1 ratio, and so forth. So that means that our vestibulocochlear nerve is intact. So that is our cranial nerve number 8, and that's good. So the next is our vagus nerve. No, glossopharyngeal nerve, which goes along with the vagus nerve. It is our gag and our uvula. So I'm going to have them open their mouth and go ah. And when I say ah, 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 my uvula goes up and down. So that means it's intact and that my gag reflex is also intact. So then my glossopharyngeal nerve is intact. That also means my vagus nerve is intact as well. So then next we're moving to the 11th nerve. So the cranial nerve, number 11, is accessory. So what we're gonna do is I'm gonna push down on my shoulders and I'm gonna use resistance. I'm gonna push up and like, don't let me push down. So you push up against it. So that means it's intact. Move my head this way, move my head this way, and so forth. So our accessory nerve is intact. Lastly is our hypoglossal nerve. This goes along with tongue movement and tongue strength. So it's, if I can like touch with my mouth, move it side to side. So cranial nerve number 12 is intact. So that is a great deal. Okay, so far, all of our cranial nerves 1 through 12 are all intact, all nice and healthy, and so forth. So next, what we're gonna do is we are testing the muscle strengths in our body. We're assessing the tone in muscles. So whenever I'm looking at it, I'm gonna assess the tone and everything on my muscles and my arms. We're gonna assess, make sure it's all even. So then our muscle tone in our upper and lower extremities are all a 5 bilaterally. This is the upper. And I look at my lower extremities also, muscle tone moving around. And our lower extremities are a 5 also, 5 plus, I think. Okay, so then we're looking at our patients like even gait walking. So as I'm walking around, I have even gait. I'm balanced. My arms when I walk, they seem to be walking in opposition whenever I'm walking like opposite, like I'm a toy marching band, whatever. So that's all tests with like balance and the Romberg test. And so that means my balance is all intact and my motor skills are all intact as well. So I have a nice even gait and so forth. Next, what we're doing is that I'm gonna use this Q-tip and we're gonna test for sensory touches around my body. So I would have the patient close my eyes. I'm gonna lift up my arm. I'm gonna use this one since I'm right-handed. Ow, I hit my chin. So I'm gonna randomly touch it and they're gonna tell me if it's a sharp side or a soft side. So obviously I know like sharp side, I'll go up here, sharp, soft, soft, sharp, soft, sharp, 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 soft, soft. I'll do it on my other arm, so forth. So the sensory seems to be full sensation present throughout your body. I don't want to use it with heat or anything like that because I don't have anything for that. But sensory is all intact with our body. Tactile discrimination between if it's sharp or soft is intact, is fully intact. And then all of it's felt bilaterally, so it's all nice and intact. Oops. And I could use a tuning fork and test for neuropathy, but I don't have a tuning fork for neuropathy for it. But if I were to test for a tuning fork, I mean, all the vibrations would be felt bilaterally, but I don't have a tuning fork. But anyway, it's all good. So what we're gonna do is we're gonna look for the deep tendon reflexes. So I'm gonna use the diaphragm of my stethoscope, and I'm gonna hold my, I'll show this. So right here, I have it dangling like this. Oops. This. My leg moves. Okay, so that's good. My patellar reflex is intact. For my bicep test, it's kind of hard to do it myself. So I'd hold it right here. And then when I put my thumb here, I would hit my diaphragm next to my thumb. And then I would watch my muscle and it would tense up, but it's hard to do that. So, but my bilateral and my patellar muscles is a 2+ for my reflex. And then next what we're gonna do is we're gonna test our brachialis. When you test your brachialis, it's gonna be right here about like 2 inches or so up from your thumb, right here from your radius. And you'll put it right there and I'll have it even like this and I'll go. In your hand, you're gonna feel like this or like pull up. and it's intact. So it's 2+ for that also. So then next we're gonna do the tricep. So the tricep is gonna be back here behind your elbow. And then it's hard to do this myself though. Usually you hit there, put your thumb there, and then you test it. And your arm, my arm kind of moves. So that's a 2+ with reflex also. And then you're gonna do the ankle. Okay, so what you're gonna do is gonna hit right here in the tendon. Oops. Make sure your legs just hang in there. And then whenever I do that, my ankle kind of just, when I hit it, it just like pops up. So my ankle reflex, wow, this is all discombobulated. My ankle reflex is intact, it's a 2+. So that concludes my deep tendon reflexes exam. All of it's intact, all of it's 2+ bilaterally. Noted. So I would say thank you to my patient for letting me do this exam for you. I will reassess their pain and say, these are pain from a 0 to 10, 0 not at all, to a 10 being the worst ever, where it's at, and so forth. Now do comfort measures, asking like, what, can I get them anything else? Can I take care of anything for them? And then if they say no, I'll be like, okay, I'll wash my hands. I'll thank them for letting me do this exam on them. And then I'll be like, if you need anything, just let me know.